Hey, Medicare beneficiaries. Here's a quick video to simply explain your Medicare options for your parts A, B, C, and D. You'll be an expert in no time. We haven't met yet. I'm Tim Gustafson. I've been a senior advocate and an insurance specialist helping people like you since 2005. And one of the biggest struggles I see my Medicare beneficiaries face is understanding the complexity of all their plan choices. I know you may feel intimidated and overwhelmed by the information overload. And that's why I created this short video designed to help you grasp your options and make an intelligent decision on what's best for you. So with Medicare, there's four parts. Medicare Part A is the hospital benefit. This covers you inpatient, and there's a pretty hefty deductible. For 2022, it's a $1,556 deductible, and that covers you for days 1 through 60. And then you have to pay per day. And as long as you or your legally or married spouse work for 40 quarters or 10 years, there's absolutely no premium whatsoever. Medicare Part B is basically everything else. It's all doctor, specialist, cast, splints, x-rays, surgery, ambulance, MRIs, lab work, blood work, occupational therapy, physical therapy, chemotherapy, any drugs administered to you through an IV or through a syringe at a doctor's office. I'm sure I'm forgetting a thing or two, but you probably get the point. And with this, there's a fairly reasonable deductible. It's a $233, and then it's an 80/20 plan. Medicare pays 80, and then you pay 20. As long as you or your legally married spouse worked for 40 quarters or 10 years, the standard premium is $170.10. Now, if you have a pretty substantial income, you may be paying higher. If you have a low income, you may be paying less. With Medicare Part C, these are all the Advantage plans. These are all the HMO and PPO plans. I know you've seen a ton of commercials for them. Around your 65th birthday, you get bombarded in the mail. And this covers at least all of your Medicare A and B benefits. So essentially, you sign a contract with that with whatever company you choose, and that company becomes your primary. And this way, you'll know exactly what you have to pay versus 20% of what you would never really know. It defines exactly what your copayment or what your financial responsibility would be for each service rendered. Medicare Part D are your prescription drug benefits. And what the government does is they break down your drugs into 5 different tiers: preferred generic, non-preferred generic, preferred brand name, non-preferred brand name, and then a specialty tier. And there's a standard formula with this where they have a deductible, and then you have your initial coverage period and donut hole and catastrophic coverage. I can go into much more detail on that on a personal basis when you schedule your appointment with them. But as far as your Medicare options, you can either go with an Advantage plan. With this, there'd be no or low additional premium to your Medicare Part B premium. You do have to pay that no matter what. And then you just have to pay copays as you use it. Now, there is a network. Some companies do require referrals, but most of them got rid of the referral requirement. You go straight to the doctor as long as they're in the network. All of these plans have something called a max out of pocket, which is a super important thing. They keep track of every copay that you pay for doctor, specialist, hospital, any of that kind of stuff. And if something catastrophic happens where you rack up, say, a $2 million medical bill, you don't have to pay copays always and forever. There's a limit. Usually it's around a $5,000 limit legally. The maximum it could be is $7,550. And once you pay that amount, you still get whatever services rendered that you need. You just don't have to pay any copay whatsoever. Now, usually this also includes the prescription drug coverage, and then it also has extras. It may cover dental, vision, gym memberships, over-the-counter items, hearing aids, telehealth, etc. And your cost with this is going to be your Medicare Part B premium, the premium for the Advantage plan, if any, and then just whatever copays you end up paying for the year. The other option is to go with a Medigap or a supplement policy. Now, this is going to require an additional premium, but there's absolutely no co-payments whatsoever. There's also no network or no referrals required. The maximum out of pocket is strictly what your premium is, plus the Medicare Part B, that $233 deductible. These plans do not include prescription drugs, so you would have to get separate there. And usually there's no extras whatsoever. So your estimated cost in your premium here would be your Medicare Part B, your 170.10, plus your Medicare supplement premium, plus your Part D premium and the Part B deductible. The thing to keep in mind is that there's absolutely no wrong choice. It's just a matter of what you feel is going to be best for you. And I can help you figure that out. So please click on the link below to schedule a free consultation for me to discuss your options with you.